Nursing assistants.
How are you doing? You feeling okay?
The growth of the overall population, and particularly the increased number of elderly people, will make job opportunities in the area of nursing assistants excellent.
I'm just going to borrow an ear real quick.
They work under the direct supervision of nurses and the medical staff. CNAs, or Certified Nursing Assistants, have met the training requirements for certification.
I started as an emergency medical technician, and I worked with some ambulance crews, and I decided that I wanted to work in a hospital just to get familiar with different departments and different job opportunities inside a hospital.
Those who work in nursing homes are often the principal caregivers, having far more contact with residents than other members of the staff. Since some residents may stay in a nursing home for months or even years, nursing assistants develop ongoing and often close relationships with their patients and respond to them in a positive and caring way.
I like working with people, and I have a lot of energy, and I feel like people that are sick or ill or have, difficulties, I think they need part of my energy to make them feel better.
They perform many routine medical tasks, such as taking the patient's temperature and checking their pulse, respiration, and blood pressure. They keep accurate records of their observations and record results of their screenings in the patient's charts. Often, this information needs to be entered into computerized record systems. Patients who need assistance with walking, dressing, eating, bathing, or toileting are usually helped by the nursing assistant. They often have to do unpleasant duties, such as emptying bedpans and changing soiled bed linens.
You really need to be open-minded in this field, and you should be clear about your abilities interacting with people, especially patients who recently have had a bad diagnosis of some disease. It's real important to be caring, so I would tell that individual to make sure that they knew their ability and how far they were able to keep intact their own emotions.
It's so rewarding to watch people feel better and get better, and it gives me a really good feeling, and that's what I like the most about what I do.
Most nursing assistants work about 40 hours a week, but because patients need care 24 hours a day, some assistants work evenings, nights, weekends, and holidays. Many work part-time, providing the opportunity for them to go to school at the same time. About 1/2 of all nursing assistants work in nursing homes, and 1/4 work in hospitals. Others work in residential care facilities or in private households.
You can work in home care, you can work in nursing homes, also even overseas. There's just not enough people in this kind of caregiving field. You need a lot more people, and there's just so many opportunities for them.
Since many hours are spent standing and walking, and patients often need to be lifted, they must be in good physical health. They should be able to work as part of a team and be willing to do repetitive, routine tasks.
There's many different medical courses, and this environment really gives you the opportunity to try out and determine what type of continuing education you would like to pursue.
Although training is available on the job, federal guidelines require nursing assistants who work in facilities that provide long-term care to complete a formal training program within 4 months of beginning employment. Typical job duties include taking patients' blood pressure, temperature, and pulse, helping patients dress, eat, and bathe, answering patients' call bells, and recording information in the patient's charts. The national average earnings for those who work in nursing homes is $6.51 per hour. Paid holidays and sick leave, medical benefits, extra pay for late shift work, and pension plans are also available to many hospital and nursing home employees. Although many nursing assistants receive their training on the job, Those working in facilities that offer long-term care must be certified. This requires completion of an accredited 75-hour training program and passing a competency evaluation within 4 months of employment. Individual states may have additional requirements. Training programs are offered through high schools, vocational technical centers, community colleges, and some nursing homes. The employment outlook is excellent. Employment will increase as a result of expansion of nursing homes and other long-term care facilities for people with chronic illnesses and disabling conditions, many of whom are elderly. For additional information, you can write to the American Healthcare Association, 1201 L Street Northwest, Washington, D.C., 20005.